In addition to the multiple new AEDs that we also have new formulations that enhance the administration and hopefully adherence of some of these agents. In general, I like to use extended release formulations. The advantages are usually twofold. One, many times they get around post-dose side effects. So it's like with carbamazepine, post-dose side effects are very common. With the extended release carbamazepine, they're much less common. In addition, it allows us, rather than taking the drug 2 or 3 times a day, we're able to take the drug once or twice per day. And the evidence in the literature clearly demonstrates that 3 times a day is a lot harder to take than 2, and 4 times a day is almost impossible to be compliant with on a consistent basis. So the 2 advantages, seemingly less side effects, and definitely improved adherence by virtue of less frequent administration of the drug. In general, I always prefer to use the extended release formulation because of the advantages of maybe fewer side effects and improved compliance. The only time that I really don't go that route is if a third-party payer won't support it and the cost is too much and we end up using the immediate release product. I don't always give the extended release product once a day if that's the design, such that particularly if you get to a large dose of the extended release product, say with lamotrigine, and the patient's taking 800 or 900 milligrams a day, I may divide that up to spread it out. But as long as they're consistently able to comply and take the drug twice a day, it's a little bit advantageous to spread it out and lower the peaks and raise the troughs so that that effective blood level is maintained as close to level as possible. The first extended release product that really impacted on patient adherence and patient tolerability of medication is the extended release carbamazepine. That was a product that needed to be taken 3 times a day and also was really problematic for post-dose side effects an hour or 2 after taking the medicine, particularly in the morning. With the extended release formulation, we're able to take it twice a day and it really blunts that post-dose side effect, and so it markedly enhanced the tolerability. A few of the other drugs, like oxcarbazepine, which is now available on a once-a-day product, also have some of those same advantages. It goes from twice a day to once a day and also blunts any post-dose side effects. Some of the other products are a little bit less important, I think, like levetiracetam extended release. Post-dose side effects aren't a concern, but certainly taking it once a day as opposed to twice a day offers a distinct advantage. We have extended release topiramate available. I was kind of skeptical that it would really change anything in tolerability, but it seems to have, so that I do have patients using it that can tolerate a higher dose of the extended release as opposed to the immediate release. And then also with lamotrigine, that molecule does have some post-dose side effects, and so it lends itself to improved tolerability with the extended release, and obviously the once-a-day product is going to be more consistently complied with. The indication for the various agents, including the extended release agents, are quite variable with respect to age. I think most pediatric neurologists, have to go outside of the package insert or off-label or whatever to use the products. Many times the studies haven't been done. More and more the studies are being done in the pediatric age group, or at least they're allowing extrapolation from adult pharmacokinetic data to get the drug approved in a pediatric population. And certainly like a drug like extended release oxcarbazepine that's approved down to age 6 or whatever, it certainly is an advantage because that's about the age that children are going to consistently swallow pills. And so now you have a once-a-day product that allows you to adequately treat the patient without having to get them to comply 2 or 3 times a day with many other products.